Marfan syndrome is an autosomal dominant disorder relating to connective tissue and growth. Marfan syndrome was discovered in 1896 at the University of Paris' Faculty of Medicine by Dr. Antoine Marfan, at which he presented the first medically documented case of Marfan syndrome possessed by the young woman Gabrielle P. The symptoms included long slender limbs and joint contractures. Marfan syndrome has been researched notably by Dr. Henry Murray, Dr. Lean Babinek, and Dr. Emily Ackard. Dr. Guerrero profited the term Maladie de Marfan, giving the disorder its official name. Marfan syndrome is most commonly diagnosed through three methods: cardiovascular testing, eye testing, and genetic testing. Marfan syndrome is an autosomal dominant trait, with 25% of cases resulting from a new mutation, meaning that of every 4 cases, only 1 case comes from mutation, while the rest come from hereditary descent. Marfan syndrome is caused due to a defect on the gene fibrillin-1, or FBN1, which is located on chromosome 15. This results in lessened skin elasticity, as well as an increase in transforming growth factor beta, which affects the function and movement of cells. Altogether, this causes changes in the strength and performance of multiple body tissues, overgrown bones, and less elastic skin. These all lead to the symptoms of Marfan syndrome. The symptoms of Marfan syndrome are all related to connective tissue and growth. These symptoms include myopia, an increased curvature of the retina, ectopia lentis, a lens displacement from the pupil, bone overgrowth, loose joints, overgrowth of the ribs, scoliosis, and even cardiovascular malformations. Marfan syndrome has other effects on a person's life besides the symptoms themselves. There's an increased risk for other illnesses, medical visits and treatments that add up quickly in cost, routine check-ins, limited physical activities and diet, limited social activity, social judgment and isolation, and increased mental health struggles. While there is no cure for Marfan syndrome, there are treatments to minimize its effects. These include blood pressure medication, visual therapy, and surgical procedures such as aortic repair, scoliosis treatment, breastbone corrections, and eye surgery. In conclusion, Marfan syndrome is a genetic disorder that affects every aspect of a person's life. It's most commonly hereditary, but some receive the disorder through random mutation. It is caused by a mutation on chromosome 15. It may be a painful and stressful disorder, but strides have been made in the medical field to reduce the struggles associated with it. For further reading, we suggest going to the Marfan Foundation and the National Institute of Arthritis, Musculoskeletal, and Skin Diseases.